Hello guys, today we are going to discuss about a laboratory test. It's a blood test. The name of the test is direct anti-human globulin test. Why do we do this test? To help diagnose the cause of hemolytic anemia as caused by autoimmune disease or induced by drugs, to investigate a transfusion reaction, to diagnose hemolytic disease of fetus and neonate. A little bit more details. The direct antiglobulin test is a laboratory test that can be used to identify whether red blood cells have antibodies attached to their surfaces. This can provide important information about that can identify the cause of hemolysis. Red cells carry many different proteins and substances on their cell membrane surface that can act as antigens. An antigen is any substance that may be recognized by the immune system and stimulate an immune response that generate antibodies. The combination of antigens present on the surface of a red blood cells determine your blood type. The major red blood cells antigen include A, B, and rhesus antigens that determine a person's basic blood group. Each person has their own individual set of RBC antigens determined by inheritance from their parents. The major antigens are surface identifiers on human RBCs are O, A, and B antigens, and a person's blood is grouped into A, B, AB, or O blood type according to the presence or absence of these antigens. Another important surface antigen is D antigen in the Rh blood group system. If it is present on the someone's red blood cells, that person's blood type is Rh positive. If it is absent, the blood type is Rh negative. The major blood group system, ABO and rhesus, represent only 2 of 33 currently recognized blood group systems. These other blood group systems include Kell, Duffy, Kidd, Lutheran group, to name a few. The DAT test is used to check if there are antibodies attached to circulating red blood cells. Listed below are some of the common conditions associated with RBC becoming coated with the antibodies. With autoimmune disease and other conditions, some people make antibodies directed against their own RBC antigens. This is called autoantibodies. These autoantibodies may be produced in autoimmune disease or with some other conditions such as lymphoma and chronic lymphocytic leukemia. With a drug-induced anemia, certain drug can induce antibodies against red blood cells antigen and therefore cause hemolysis, even without the presence of the drug. Sometimes drug may coat the surface of RBCs, causing antibodies to react with RBC. This condition is relatively rare. The drug can induce antibodies to both the drug and the RBC itself, resulting in destruction of RBC in presence of drug. This is seen with some antibodies such as IV penicillin, cephalosporin, piperacillin. Be sure to tell your doctor about a drug you have taken recently. If the doctor suspects drug-induced autoimmune anemia, the suspect medication will be discontinued. Symptoms typically resolve promptly after the drug is discontinued. With mother or baby blood type incompatibility. A baby may inherit antigen from its father that are not on its mother's RBC. The mother may be exposed to foreign antigen on her baby's RBC during pregnancy or at delivery when some of the baby's cells enter mother's circulation as the placenta separates. The mother may begin to produce antibodies against these foreign RBC antigens. This can cause hemolytic disease of the fetus and neonate, usually not affecting the first baby but affecting subsequent children when the mother's antibodies cross the placenta, attach to the baby's RBC, and hemolyze them. However, any baby may be affected by a hemolytic disease of the fetus, a neonate caused by antibodies to the RBC ABO system. This generally is mild, which is fortunate, as it is the leading cause of maternal antibodies attached to fetal RBC today. A mother will be screened for antibodies during pregnancy and again at delivery. A DAT test performed on the blood of a baby born to an at-risk mother will determine if its mother's antibodies have attached to baby's RBC. Following a blood transfusion, before receiving a blood transfusion, a person's ABO group and RH type is matched with that of the donor blood to prevent a serious transfusion reaction from occurring. That is, the donor's blood must be compatible with the ABO group and RH type of a person receiving the blood so that the recipient's antibodies do not react with the destroy donor's red blood cells. If someone receives a blood transfusion, their body may also recognize other RBC antigen that it doesn't have, such as those from other blood groups, as foreign. The recipient may produce antibodies and they may become attached to these foreign antibodies on the donor RBC circulating in the bloodstream. People who have many transfusions are more likely to make antibodies to RBC because they are exposed to more foreign RBC antigen. If someone shows symptoms of a reaction after transfusion, a DAT will perform as part of the routine panel of investigation to determine if those antibodies have attached to the transfused donor RBCs. Sample required is blood,